Okay, hi guys. This is World Fertility Day. Another talk. We're having a talk with Professor Sibit from Avita's Fertility Clinic, and we're talking about what is egg donation. Um, so, sorry, the topic is fertility treatments with donor eggs, and the first question is, what is egg donation? So, Professor, thank you
Yeah,
very
so
much for
first,
joining us first. Sorry. And maybe if you can just give us a quick background of the fertility, where you're from, the fertility clinic you're from, that you represent, and what it is that you do.
yeah, Leanne, first, thank you for the opportunity, and it's wonderful to have a chat to everyone on World Fertility Day. So I'm from Evita's Fertility Clinic in Pinelands, Cape Town. I'm associated with Prof. Kruger, Dr. Human, Dr. Hanekom. And yeah, so the topic tonight is that of egg donation. So as we know that the biggest issue in IVF, and everybody that went through fertility treatment will know that age is the predominant problem.
Yes.
So we many a time, I always look at these young, beautiful women coming in, and then they're 41 and 42, and they think because they're still looking good, they still have young eggs. But
Yeah.
unfortunately, that's not the truth. So
Yeah.
we know that in the 10 years before you go into the menopause, so on average, women go into the menopause at 50. So in the 10 years before, so from 40 and onwards, you really start to struggle to conceive. There's
Yeah.
also younger patients who struggle to conceive, and those are the young patients with poor ovarian reserves. Some women genetically went into the menopause earlier. Other women had multiple surgeries on their ovaries, don't have a lot of eggs left. And other women had cancer therapy. So
Yeah.
there are also regions in younger patients where their reserve is depleted, and that also makes them a poor candidate to conceive. So in
Yeah.
all of these cases, in the older patient or in the younger patient where their reserve is depleted, that's where we use an egg donor. So just one point, Leanne, is we always, it always takes some time to explain to the patient to say, but listen, remember, your success rate is related to the age of the egg. So even
Mm.
if I'm 45 and I use a 20-year-old egg, the success rate is that of a 20-year-old egg. I'm not exposed to the risk of an older patient of high risk of genetic abnormalities like Down syndrome,
Yeah.
because the age of the egg predicts the outcome.
Yeah. Okay, awesome. Why would someone struggling with infertility make use of donor eggs? And maybe we talk about freezing and own eggs for medical and social reasons.
Yeah, so as I just said, so there's the younger patient where the reserve is depleted due to surgery, repeated ovarian surgeries, and that's actually a plea from me, is being an endometriosis surgeon myself, is that if people start to operate on your ovaries for cystectomies, one must be very careful.
Mm.
Before you have cancer therapy, freeze your eggs, because we can always use the eggs later. So freezing of the eggs, as from a social point of view or a medical reason, Leanne, and you've just briefly touched on that.
Mm.
So socially is when you reach about 34, 35, and you haven't met Mr. Right, or you just come from a bad breakup of a relationship, reality says, I'm not going to be pregnant within the next 2, 3, 4 years. Then I'm 39, and that's the time where my fertility starts to decline. So if you haven't met Mr. Right and you want to have children before you round about 40, 34, 35, that's what we talk about, social freezing, and we should
Mm.
freeze those eggs. Medical reasons, and I just want to touch again, if you are in the process of cancer therapy, you've got to freeze your eggs before you
Yeah.
go through cancer therapy. And secondly, on repeated surgeries, and that's where endometriosis is really the culprit, where you have recurrent ovarian cysts and you have operations. That's also then very critical to freeze your eggs in that time frame.
Okay, awesome. And then our last question is, what are the different options when making use of donor eggs during an IVF cycle?
Yeah, that's a very interesting question. So, there's a fresh egg where you are synchronized with a donor, which when I mean fresh, they donate a fresh cycle. Your uterus is in synchronization with that cycle, and you use all the eggs in that cycle. That is the one.
Yeah.
An egg bank, and that is where we are really trying at Evitas to make it more acceptable and easy accessible for the patient, is to have a dedicated egg bank. And what that means is there are always some eggs available, Leanne. There are always eggs available, and we sell it in batches of 8 to 10. We've got currently a reputable egg bank where if you have 8 eggs, your success rate is about 55, 56%, and that is with 8 eggs. So the number of eggs is also very important, but those are the two common sources. It's either fresh or it's the egg bank. And obviously, if it's the egg bank, it's also a bit cheaper and quite substantially cheaper than going the fresh route.
Okay. And then just our last question is, sorry, let me just get that. Do you have any words of wisdom or something to say to women that's currently dealing with infertility right now on World Fertility Day?
Yeah, being a fertility specialist, obviously, it is close to our hearts. And, it is always sad if you see a patient who perhaps have been ill-informed. So my take-home message will be that if you get to 35, 36, and you are not pregnant, please see a fertility specialist to discuss the options, because your time is running out. If you are 34, 35, and you haven't met Mr. Right, and you really want to have children, consider egg freezing, or before cancer therapy, or before repeated surgeries. But I think women today are well informed, and we need to be then also informed about our own journey regarding fertility. And age is unfortunately the main reason why many women won't have their own babies with their own genetics, but then need to move on to donor eggs.
Okay, thank you very much, Professor Sibet. Thank you for your time that you took to do this talk with us. And we hope to see you again soon. And thank you for joining us for World Fertility Day and everything that Evitas does for the women in South Africa when it comes to fertility treatments. Because we just had a talk earlier with an actress, Teresa Bam, and she's had fertility treatments with you guys. So it was an amazing story to hear from her. And she's back with you guys for a next treatment. So thank you very much, Professor, and have a great evening further.
Yeah, Leanne, and thank you again for the opportunity. And to all the women out there, there is hope. I think that's the important part. There's always hope. So seek advice and you will be helped. Okay.
Perfect. Thank you very much, Professor.